Hey guys, my name is Cole Brenny, founder of PracticingDentist.com, where I teach dentists to master their profession, learn the business of dentistry, and build practices that they love. So today I'm going to talk about a topic that I get asked a lot about, and it has to do with dental graduates or new dentists and deciding, do they need to do a GPR or AEGD, or can they go right into associateships? So if any of you guys have heard me speak before, I'm a big advocate for dental ownership, and for being your own boss, starting your own practice. And one of the biggest marketing points that you can create in a practice is providing advanced dental procedures, advanced services, training yourself well, so patients, A, have a lot of trust in you, a lot of faith. They say, hey, this guy's done a lot of work. He's highly trained, highly skilled. I don't have to run all around town to get different procedures done. If I need a root canal, he doesn't funnel me off to a different dentist downtown that I've never met. Patients really like to stay in your practice. If they trust you, you treat them right, you build the great patient experience that I talk about, they want to stay in your office and they want you to do that surgery, you to do that endo, you to place that implant. So by training yourself well, you're going to really market yourself and your practice, build trust, build patient loyalty and referral base. And it's a great way to take care of patients and to build an awesome office. So do you need to do a GPR or AEGD? I would say no, not necessarily. Not all GPRs or AEGDs are going to train new dentists well in the placement of implants, give you a ton of surgery experience, grafting experience, maybe some ortho. And a lot of GPRs might not have the caseload and the type of patients you need to do those cases. And that's something really important to think about when you are a young dentist. You don't realize that just because you learn ortho, you learn implants, that you're going to necessarily be able to do that in your practice unless you have the right location and the right patient type. Patients that A, want that type of treatment, and B, can pay for it. So something to think through. Same thing with a GPR AEGD. You need to find a GPR AEGD that allows you to be with a patient base that's going to offer tons of different treatment options. They're going to allow you to do complex treatment planning. They're going to be able to allow you to pay or allow them to pay for the cases that are going to be more spendy than normal. This is really important. So what I would say is think through, do you need to do an AEGD GPR? I would think through, what are your career goals? Do you guys want to go into practice ownership someday? What type of dentistry do you love? Because advanced dentistry can be pretty stressful sometimes, and it takes a long time to learn. It has a big learning curve. It's going to take years before you get really comfortable. So if you don't mind stressing yourself, jumping into new territory, taking a risk, and pushing yourself, if you don't mind doing that, then put yourself in a great position and go out and get a great AEGD GPR that allows you to do awesome cases with good instruction and supervision. Have great teachers. Find a place that has great teachers, great patients, and the ability to do the cases that you want. So I did a VA GPR at the VA here in Minneapolis, and it was great because it was a heavily surgical GPR where we did a ton of surgery, oral surgery. We rotated through the oral surgery department. We worked with oral surgeons. We placed implants. We did grafting. We also had the benefit of working with VA patients that were under VA insurance plan. We could do any treatment we wanted to. And there were prosthodontists nearby, endodontists that we worked with. So I was able to work up treatment plans and cases where we did full mouth reconstruction in year one. So something I could never have done on my own, or if I would have done it on my own, it would have costed me tens of thousands of dollars to go to special courses. And then even at that same time, if that's what I've done, I still wouldn't have had someone to walk me through and kind of hold my hand through my first couple cases. So that's the benefit of an AEGD GPR. You're going to jump in year two after that first year of high intensity training, big cases, intense surgery, and you're not going to make as much. You're going to be working a lot more for the money, but you're getting the training in year one, which is really important because year 2, 3, 4, 5, you can just build on those skills. And it gets you to the place you want to be a lot faster. Not all AEGDs, GPRs are created equal, so find one that fits what you want to do, the type of dentistry you love, has the patience and the caseload that you need to learn the skills that you desire. So look through those. Which ones are going to offer that opportunity? I'm not sure. You need to look through and do your research to find one that does that. If not, can you do it as an associate? You can, but you're going to have to pay for the training. because most of the time you're not going to be in a location where you're going to have a ton of patients that are going to do high-end cases and let you do the cases because you have zero experience doing it. So you're going to have to go and you're going to have to take the courses, you're going to have to travel, you're going to probably have to do it more independently on your own, and you're going to have to get lucky in finding a location and a patient base that's going to allow you to do those types of cases. So I would say it's more difficult, it's going to take longer for you to get where you want to be if you don't do an AEGD GPR, unless you get in and you have someone who has a great practice who wants to hire you soon after dental school, that's going to allow you to work in their practice and offer you some support and guidance along the way. So if you have that setup, that's a great setup, but that's rare. So, depends on what type of dentistry you want to do and where you want to be in 5 years. If you want to be a practice owner delivering advanced general dental procedures consistently and building your practice 5 years out, then I would recommend AEGD GPR, do some advanced training, take some more courses on top of that, and you're going to be where you want to be. So hopefully that answers the question. If you have more questions, you can email me at drbrenny@practicingdentist.com. Check out my other training material. I'll have Liftoff Academy monthly programs. I'll send an email out about those, but those will be launching now every month. And there's some interesting topics we'll hit on. So if you have any questions or you want to learn something particular, send me an email, guys. Awesome. Thanks a lot and good luck.